is that true? I was like, yeah, that is true. And that is proven data. So now, if there are 20 of us on here, it is safe to say, based on statistics, that at least 5 people do have a mental health issue. And please, I'm choosing my words carefully, right? There's a difference between mental health or mental illness and mental health issue or mental condition. So what we refer to is you may have a mental health issue, not necessarily the illness. And I will explain the difference as we go along. If it happens to escape me, please, you can ask. And that is to test to see if you are paying attention. So now, when we talk about mental health conditions or illnesses, usually people become alarmed and people feel like, it's not related to me, or people feel like that is a bit too much or heavy of a topic to talk about. But then I always say this: it is so much easier to talk about hypertension, so much easier to talk about diabetes. But then when we talk about mental health conditions, then we try to protest, or we tend to cringe or fringe and feel uncomfortable once we talk about mental health conditions or issues. So let me contrast these two real quick. Let's take some medical conditions. When we take the issue of hypertension, if you have issues with your kidney, you may have high blood pressure, which will lead to hypertension, right? And you hear me say, which will lead to high blood pressure, which will lead to, because high blood pressure is just a symptom. So the fact that your blood pressure is high does not necessarily mean that you have hypertension. And that is what I mentioned earlier, that you may have a mental health issue or condition. Does not necessarily mean that you have the illness, which is the diagnosis. So you may have a kidney malfunction, which may lead to hypertension. In the same way, you may have cardiac issues, which will lead to hypertension, right? So now pay attention. An issue with an organ leading to the illness. That is one to note. You may have an issue with your pancreas, which will lead to diabetes. And then you also may have issue with your weight, which will also lead to diabetes. So you realize that the overweight is not an issue to do with the organ. So in the same way, you can have a chemical imbalance, which will lead to a mental health issue. Our past experiences can impact our mental health. Financial stresses can impact our mental health. Academic, relationship issues, right? All of these can lead to mental health issues, right? So it is very important that we pay attention to these things and realize that mental health is really not just something that we are excluded from. I mean, those of us on here and our friends and families. It could happen to anyone, and it could be a malfunction or an issue to do with an organ or something in the body, or it could be something outside the body, right? And genetics also do play a role. So now, what are some of the perceptions for which it makes mental health conversations very difficult to have, especially among Africans and African Americans also? So some perceptions that I've heard, seen in the past and recently, is that Ghanaians or Africans don't get depressed, right? There's nothing like anxiety. But if you really look at the symptoms that the person is having, they're having more of an anxiety than associate. And that happens a lot. I'm hot, but I'm not stressed. Chamo, I'm so hotness in the air party. I don't know idea who I'm assisting and what stress level. And your stress level no, is also so high that at this point you have an anxiety. And the symptoms are clear. You are looked down upon when you talk about your mental illnesses. And I always give this example. Please pardon me if I use your name as an example, right? But Michelle Screen is what I just mentioned. Nothing personal. Okay. For most of you, actually, I don't know, so it cannot be personal. So the name I do see right now is the Mamifa Ejalem started. On the minister means to. So let's say James and I say Pastor Amos appear. Okay. And I chose either one of them because of their title. So both of them are pastors, religious leaders. And as the shepherd of the flock, I mean, leading for. And let's assume that in your community, with Pastor Pierre in Michigan, I think you're still in Michigan, with Pastor Pierre in Michigan and the biggest hospital, psych hospital in Michigan. Yes. Hey, microphone back up. Yeah. Actually, he graduated recently with his master's. Congratulations, Pastor. Um, so with him in Michigan, right? And then there's a huge psych hospital in Michigan. And one of the church members sees Pastor coming out of the psych hospital, right? And I want to paint a picture of how the conversation is going to go. So let's say Sister Rejoice is a member of his church, and he sees Pastor Pierre coming out of the psych hospital. Then Sister Rejoice will pause for a second. Pastor, into a he said, Nana Dreamukano. Then she starts to process. Into the last of us, or okay, then she calls Jimmy Cash. And they'll be like, Uncle Jimmy, Beji say me who Pastor Pierre no office high call no more ba. Papa never said that dream you. Then Uncle Jimmy will also process for a second and then call somebody else, Simone, and then be like, Simone, Beji say Rejoice say, Pastor that dream no who no pass no office high cable, no akwaji nindro. You see how the conversation starts. Do now for the building up was so now we go to so that's not the first thing that comes to mind. Oh, that's what came to your mind, which is good then. I guess that you have a better understanding. And this is where I'm even going with this, right? With that personality. Who's a pastor will be leading discussions at church, will be leading some conversations, will have to have some hard conversations with some people. Then it's like, Papa P.KAY. Not being here, anything alas, they know just why them working in an so. Do you get where I'm going with this? Then the conversation continues. Then it starts to attack his personality. So that is in the case where pastor is even not mentally ill or doesn't have any mental health condition. But let's say Elsie, right, does have it. And as the leader of the women in the church, and we find out that, Elsie has depression or anxiety. And as you use those because they are technically and bisa. But the fact also is those two are the leading causes of the leading mental health conditions in the world. But it's not that serious. So let's say Elsie has anxiety, and as the leader of the women ministry group and all that, and we expect Elsie to be very religious. Most will be to almost say, hey, Elsie, one more home crime or bonsama foul. You get what the point I'm making? So we are equating having mental health issue to poor spiritual standing, right? So when we are looked down when we talk about our mental illnesses, and to know say subsequently we're having a serious conversation, and she makes some contributions. People start to look at her some kind of way because it's like, as a no, as I said, one for right? And sometimes we joke with some of these things. And what we do now. And that is just even a normal conversation with no like nothing like that. So it's something that is gone on for years. Hence, if I do have it, it is very difficult for me to talk about it. How many times do you see people talk about their hypertension and diabetes, especially? Much more of like so much of what me question. If me question or baby now you introduce me and the person who introduced me used the doctor title no. And the point na who may be about doctor me pacho me show na say yeah na me fin eh me ya na me say ma me hwe enfin me hwe adwuma wa do dan na ni also nya me die ni bia. So the point I'm making is this, but I've never gone anywhere for me to be introduced as a psych practitioner for someone to come to me with their direct psych issue. Oh, Madame Fubi, the best case scenario. It's always Madame Fubi. It's never them. But, right. But then if it's a medical issue, then they claim it as DS. They'll give you the full symptoms and everything. Right? So that is because of the perception associated with mental health and all of that. That is why people try to massage it or don't even talk about it. The other thing also is mental health is usually equated to or referred to as craziness. And now, for a want of better expression, waboda or being mad, right? And because of the connotation that comes with these words, it makes it very difficult. And talking about perception and how it impacts treatment, I went to the Accra Psychiatric Hospital. For those who knows where it's at, it was Asylum down in Accra, not far from the PHILGOOD head office, from the Ethel head office. I'm not far from MTN SU4, huge building, right? That roundabout, is right there on the left. And they have a bus stop right in front of the main gate of Accra Psychiatric Hospital. But would you believe that most people that comes there for treatment will alight at the bus stop prior to that one, then use who's a friends to walk. And in the and I said like they use the back gate or more small gate then they will use that side to come in because they don't want to be seen. Oh, yeah. Nah, it was short, didn't you? It was sorry, yes. Well, only in Ghana, filling station, very sure. Or filling station, the gas station in Chehono, sir. Yeah. So that is where most of them will use. So that is one. Two, people will bring their wards for site treatment and abandon them. They'll never come back for them. There are some people who are permanent inmates, like not inmates, permanent residents over there. But then, owu ye na nebusia forever. I have a pre-body. So it's quite unfortunate. Only in Ghana na ebusia do funu say at for. All right. So now let's look at some mental health conditions. So we've defined what it is. We've talked about some of the perceptions and stigma. So let's look at some of the conditions. And you realize, you said, when we say mental health, it is not about someone with schizophrenia. And the ones with schizophrenia, and I think I don't have schizophrenia on here. So let me mention what that is. The ones with schizophrenia are typically the ones that we see on the streets in Ghana. So those people will be responding to internal stimuli, they'll be talking to themselves. Sometimes they become aggressive and tend to hurt, right? So yes, rejoice, it's all about the stigmatization. And that is why we have to have more conversation about mental health to reduce the stigma associated with it. Then we can easily seek help and have conversation about it. So the skills, are the people that typically responding to internal stimuli, We have paranoia, delusional, those that have fixed false beliefs, and then those who always think that someone is after them or someone is going to hurt them, right? And that is the group now typically we see outside. But here's the thing: if you come here in the States now, you have people with schizophrenia who are very high functioning. And I always tell people, say, so okay, during lunch break, also be funded dry, blood pressure drop. Some are mental health medications. And I said that to make the point to say there are some of us with mental health conditions and we are very, very high functioning. We work just with you, right? So the fact that you have hypertension and could still go to work, you could still have bipolar, oppositional defiant, you could have anxiety, depression, any of that, and still go to work, all right? Okay, so let's run through quickly what some of these conditions are, and I'll explain each one briefly, may go too much into details. At the end, if you have any questions about any particular one, we can address. So we have depression, we have anxiety. These two are the leading mental health conditions in the world, right? So depression, and I'll use both depression and anxiety to define bipolar. So bipolar, bi means two. Right? I know that we have Greek and Hebrew students on here, so when it comes to languages, not much better. Bi means two, the polar is the mood, right? So bi, which means two moods going on. So we have people who have cycling of their mood. There are different types of bipolar, there are different cycling moods. For the purposes of this education, we're not going to go into all of that, okay? And for any of these mental health conditions, for diagnosis to happen, you have to meet certain criteria, right? Certain criteria before you could be diagnosed with it. So once again, you may have the symptom, but it does not necessarily mean that you have the condition. So if you could see me and see my hands, I'm going to use it for demonstration. If you're just listening and not watching, that is fine, follow along. So my left hand is depression, my right hand is anxiety, okay? And left is 0, 10, right is 10. For every individual, an average is fine. So let's take an average between 4 and 6. A bit of anxiety is good because it helps us to be able to achieve and finish our task. A bit of depression is also good because we are human beings, we respond to emotions, right? Or instances that happens and affect our emotions. So an average between 4 and 6 is fine. If you start to go between 3 and 2, then you're leaning more towards depression. And if you start to go between 2 and 1, 0, then we say you are clinically depressed. One adjective. Now you are being clinically depressed. So in the same vein, 4 to 6 is fine. If you start going between 7, 8, we say you're getting anxious. If you start to go 9, 10, we say we are very anxious. Now, what are some of the symptoms that you see if somebody is having depression or anxiety? Let's start with depression. As the name suggests, you are depressed. So everything is going low. For the most part, your mood is low, so you don't have any energy, you don't have any interest, you're not doing the things you once enjoy. You're sleeping so much. For some people, they cannot sleep because I just want to drink. For some people too, they tend to eat so much because they are so depressed, and then it's called comfort eating, for the one of better expression. When you are doing that comfort eating now, and your fruit and vegetables, it's more sweets and junks and stuff like that. So then it affects your weight and all of that. So that is typically the depression. Then the anxiety, things are going up, hence you start to have palpitations. Then I said okay, and all of those symptoms. So everything for the most part is going up. You can sleep, you're staying up, racing thoughts, all of that. So those are some of the symptoms. And I always tell people, for me, when I was a bit younger, since I'm still young, but not that young. But when I was a bit younger or much younger, I used to be a very, very shy type, very, very anxious. And whenever I do anything public, my palms especially will start to sweat. Because I couldn't so I feel the answer me so. Then it was also an answer my started also. So if you even pay attention, if you've listened to me for some time and you really pay attention, you realize, hey, do baby, I'm a so fast. I have to catch myself and then slow down again. It's my coping mechanism, right? So I'm coping with my anxiety. So I talk fast so that I don't miss starting also. And then I also talk fast so that I can finish early and get out of the stage. I've used that to cope for years. And at that time, I didn't know all of this. It was just my normal coping skills. The other thing also I did was because I've been to, right? I always did that. And my mom always fought me, like, and and I'm going to use an example. Please, I'm not making fun of anyone. We went to a funeral at Pokwase and we had to do the walking past the and I had my hand in my pocket. And because she's always been on me with my hand in my pocket, she turned around and was like, and unfortunately, there was someone with leprosy whom we knew from the community who was also in the line, but not Ben yes, sir. Or carry it out who no say, so I am a manuapa, right? And for me, it was a coping skill for me. If I'm doing public speaking and I even have a microphone, bakuni crab mic na bakuni she button. If you said you show me button dry rear, then I will change the position of the mic, like switch hands, and then the other one, which is sweating with the mic, will also go into my pocket. So what I'm trying to get to is this: we all do have some challenges. We all do have how we cope with it. Once you learn to cope with it, first of all, once you identify your challenge and you learn how to cope with it, then for the most part, you take it care of it, right? Okay, so that is depression, anxiety, and then bipolar. So the bipolar is usually when they go through that cycle. And typically you hear say, oh, whether near bipolar, it's just because ne boy ya ne so it's that cycling, and America. Typically, people will say, our dear women are bipolar. It's because they have a lot of hormones going on, which is affecting their mood. It's answer won't go through being, audience or much or more, and say or more break. So I'm saying miracle. So at this point, let me skip on to the next one. This one is interesting because you don't usually hear it in the Ghanaian community. Oppositional defiance behavior. And then the Pastor Les Becker said, but me patcho, that is not the treatment. That was really on a light note. But oppositional defiance behavior is obia oti etia, right? So that is a bit different from antisocial personality. And that is also, and you obia on pedipa. That's different, and I'll explain later. So positional defiant behavior is obi oti etua. Men ko or se me ko. And I'm if you neighbor, and you will not or yet. And it's usually in the teenagers. They are very, very defiant. No, it's not common as in diagnosed and treated. No, behavior is very, very common, but a treatment is very different. They're very treat. Charlie, now, passing men go up about over two no fear. Your treatment. When you 2 doses are ever fix it for the most part. No, but I was making the point that it's not common as diagnosed or as a diagnosis in the Ghanaian community. Not the same thing. Oh, same thing in the meaning baby. If you cry or lie, so Mambo Biedi. Then the other ones are like addiction, and there are various forms of addiction, right? So addiction comes with when you gain a tolerance, and then you gain dependence, and they become addicted to the substance, right? So some people are addicted to alcohol, cocaine, drugs, all of that. Right now, social media addiction and check even when they were DSM-5 because it's becoming a big deal now. Then we also have dual diagnosis. So which means that you have two or more of conditions going on. It could be addiction and a mental health condition or multiple mental health conditions. We also have eating disorders. So there are different types of eating disorders. We have those who are anorexic and we have those who are bulimic. Or who on my own DD because of person beginning weight. So they are always conscious about their weight. Therefore, they don't eat at all. If you want to say kakra twi minimum because they are not there. But Odibia, they will find other ways to get it out. Either they will take purgative to get it out the backside, or they will purge, like what they say, and no force and no affair to get it out. Or more time for so that is eating disorders, right? Then we have ADHD, which is attention deficit hyperactivity disorder. So there are two things. One has the deficit in attention, and then also one is also hyperactive. And I always ask this question, and please give me the answer in the chat. Which of these two do you think will receive treatment or more likely to receive attention? Attention deficit and hyperactivity. Yeah, I want to see how many people contribute. That is why. We person be on mute, no baby, and then if so be beauty, then in your mom, no, in All right. While we're doing that, oh, okay, hyper. Okay. So I got two hyper, three. Okay. Most of us are going for hyper. So most of us are going for the hyper, and which is true. And the reason is this. Me ba we do mpɛ ne ho asɛm o, which ade si hɔ no ɔbɛkɔ aba abɛto no na ɔte hɔ no ma. And that is the attention deficit, not necessarily attention deficit. It's not like exclusive just because it's beating up for interest or attention deficit. But attention deficit for them are those that are usually absent-minded, right? Into to be sustaining attention. Into once in a class or share the course, but once a while, again, I want that way. And if you really know how to detect, you realize that you're having a conversation with someone, then they start or more eye contact, start shifting. It was also about say, Nenino started echo because at that point we're facing out not need that baby for, right? And there are different gestures that they have to let you know say they are not paying attention anymore, and that is where most of the time say teacher for tradia they ask for what is the correct term? They ask for you to repeat what they said, or they ask questions to see if the students are following, so that you know that they are not really focused. Then the hyperactivity for them, omono eye keka keka kaka, unable to stay still, always on the go. They don't have time for something that takes too long, right? And we find it difficult to deal with people like that. Therefore, they are more likely to receive help. But then their attention deficit in the say, or more hard. Therefore, we don't usually give them the help that they need. And let's pay attention to all of it so that we can help as needed. And then we'll also have autism. And the biggest thing about autism is autism is a spectrum, right? So we have people on one end of the spectrum, and then others also on the other end of the spectrum. But what I really want to say about autism, and I think we've heard and seen so much about it, but the key thing I want to say about autism all the time is people with autism are very talented, especially those at the high end of the spectrum. Extremely talented. The biggest problem is we don't know much about it and we are not able to harness their talents. What was it? That is the biggest problem. Ejalems Yedase for joining. I'll say my last mental health patient is waiting on me, so I have to go. And thank you very much for joining. And maybe you can finish with him or her and then rejoin to answer some of the questions and share some of your experiences. So they are very talented, but unfortunately, we don't harness their talent. Um, for some of them, right, like Ebane colors are, they see way beyond the colors that we know. For some of them, they are so attention detailed that they don't miss a mark. I quite remember some Boy Scout group would be they went for camping, and there was this autistic kid in there, and the camp director made him in charge of security. Kifubwa, like a bit more fine details of what happened, including time, tone, colors, like height, all of that, because on also the talent. Some are also, when it comes to drawing, one of the best. If you've flown through JFK, the city of New York now, it was drawn by an autistic kid after they flew him in a helicopter over the city. We see here, out of memory, drew that out. And I always say mental health is not a death sentence. Unfortunately, because Nimdia knew and how to manage it, we clam it all together and we treat everybody the same, which is very, very unfortunate. I already talked about schizophrenia, and I also have on here learning disabilities, and there are quite a few of them. But it is interesting to note that most mental health conditions start before the age of 14. And I said this to say that about when 14, 16, 18 comes to you that they have a mental health condition, most likely you're going to dismiss them, right? And usually they don't even come with the diagnosis. Sometimes they do. But whether they come with the diagnosis or the symptoms, I always tell my patients, it's not how we label it is not as important as the treatment we give to it. Because sometimes people will come and they have bipolar, but they don't want you to tell them that they have bipolar. They don't want the diagnosis bipolar. And I always tell them, like, medications are on they say, no matter how you call it. So let's not be too hung on the name, but let's focus on the treatment. Kindly mute other listeners. I don't know if there's someone else. All right. Okay. Okay. So let's look at this diagram on the screen, right? 1 in 4 affected by mental illness, as I mentioned earlier. 8.6 million adults have suicidal thoughts. Suicide is the third leading cause of death in the States. Children with anxiety disorders are least likely to receive treatment, and it's not just anxiety, even depression and other conditions. 1 in 30 experience PTSD, which is post-traumatic stress disorder, and that is not a soldier for nkwa. Nti Dr. P.KAY more PTSD. Anytime you're exposed to any traumatic event, especially when there's a repetition of it and all of that, that can cause it. Obi on my when your accident be pay, there are certain places I want to be driving. I know 3 people when it comes to driving. Let me give you 3 experience people I know. One on to driving or construction zone, and so or to car it's a construction zone now, just like Okatana, so they go through it. Bako on driving highway. And it's not because they are not proficient in driving, it's because of an experience they had on the highway. When I was in school, so Bako now owned to me and driving across a bridge, right? On only the animal, the other any PTSD, it was a phobia. And to know to me and driving, which is a part of anxiety. To know to me driving across a bridge. Anytime I bought clinicals, there was Cincinnati, and one of our clinicals was in Kentucky, Cindy. Nti anytime I be call sini bia no just obe park Cincinnati part no be a fado na or that back seat nim, right, and sand with me akọ Kentucky akọ clinicals. So these things are real and these things like get serious. So these conditions, any mental health condition at all, can affect children, can affect the rich, can affect the poor, religious leaders. Yes, so religiously powerful, and Adam for no, right? Can affect us also. Spirituality and mental health is also a different topic. Cry a bit maka wase. Before no. Those that they take them to prayer camp and then tie them up, all of that. And then culture and mental health. That is also a different topic altogether, right? And our culture does affect the way we view mental health. And I think we've mentioned some of how our culture have shaped our thoughts towards mental health. Okay. So now, let me run through real quick so that we can have time for questions. Mm, mm. Okay. Then let me talk about stress real quick. I already talked about anxiety and depression, and then I'll get into I will not do the personality disorders, and I will do the psychosocial that work for us. So stress is some. You remember the definition that I gave, right? Our ability to manage our normal stresses. Hence, the question is, what is stress? So stress is something that comes upon us either by ourselves, from our external environment, or anything at all, which affects our mood or how we react. And usually, it leads to anxiety, right? So when we get that, we can it can affect us, and the symptoms that I mentioned for anxiety, are all the same. But who's a obu ordoma, they tend to bite their nails. Already more. But obu ordoma already more. And when they are anxious, they tend to bite their nails. Some people uses drugs to manage their anxiety, and that is a maladaptive behavior. It is not a good thing to do. The problem we have is sometimes people try to manage whatever condition they have or whatever situation they have, and then they go for the other extreme, which does not help. Due to stress, also you are constantly worrying, and anytime you're stressed, the body releases certain hormones, which helps you to deal with it. When it gets to a certain level, now for the body now can manager, that is when you tend to see those symptoms, and that's why we have the fight or flight, right? Nti asɛm bi si a either say wobɛgyina anim na deal with it, and also say wobɛdwane. And the body really gives us those hormones to deal with it. So there are personality disorders. We have cluster A, B, and C. We're not going to get into that. If we happen to meet again, we can discuss that among others. But let me talk about the psychosocial that worked for us. And I use the past tense worked for us because CCR, the significance that these psychosocial has, we don't put on it anymore. We've traveled to the land filled with milk and honey, which means that everybody is more individualistic. Hence, we don't value the things that we used to have. So one that I always talk about is our structured family system, the extended family system, right? Uh, that has always been part of us, and it has been part of our psychosocial support system. So when we say psychosocial support now, so psychologically things that support us, and one maker, psychologically things that support us. It is psychologically being purchased a dream, things that support our mind or more of our mind, not brain. So things that support our mind and help us function well. So when we have the structured family system, and let me give you this example. When we were younger, right? That sounded like hunger, but I meant when we were younger, near Shano, then there were quite a few of us in the house. We had neighbors, right? Let's say Ma Fifia, the only thing she has to yell out is Auntie Lizzie Mekwabo. And once she says Auntie Lizzie Mekwaba, Auntie Lizzie gets the message as Mekwaba and Kranu of Intia from Mumami. Like it is a natural communication that happens. So I'm making the point that we may not name the friend babysitter until I traveled. Like I didn't know what that was. But then when I also got into management and I was the director of nursing for a couple of years in the hospital, I realized how much babysitting affected people and their productivity. People are calling off, people are getting fired, people are getting points, people are coming late. They can't even work well because in the middle of the work, your friends and the buy a school, so they don't have any family member to go and get that child. Like it's a lot, and we all experience it. But when we had that structured family system, where everybody took care of everyone, it took a village to raise us, CC, we don't have it like that. It's quite unfortunate. And even when you go to church, now, especially for those of us with special needs kids, nobody even want to assist. And I say neurodivergent kids, nobody want to assist. And I want to make the point that people with neurodivergence, whether autism or any of those, mepacho and sight, it is not a communicable disease. So you getting close to them will not make you have one. It's somewhere where somebody was like, "Hey, we and also I'll just say, hey, man, now we got away." And yeah, as the fact that we yeah, also me patch it doesn't work that way. It does not. So our family support system is very, very important, and I always preach that we should go back to that, and it will reduce a lot of stresses that we go through. And our social support system, right? Our social support system, as in like obi kwa kwaje aware no afre ne nyina na yɛkɔ na yɛkɔ akɔta n'akyi anaasɛ sɛ bi obi enya yie, you see the amount of people that goes to the house and then assist the person. Obi eba bewo ɔno no enya ne ho na ɔso ɔbɛwo so no na gya ne baby shower. Baby shower yɛ ma me first born nam sɛ nkra miɛnsa nyina be yusu bi ma bi ɛwɔ no nkra kɔ yɛ de kyekyɛ. So that is the extent to which that support, goes a very long way. The other thing also is, maybe actually I'm financially cash strapped, right? Like Missika said, this month balance and balance it. Then I call terrible and then terrible, Charlie, I beg, make you sort me out this thing. In some cases, you could get it for free, which is, I know you're 100% good, right? Into terrible, Mitchell, the cash up here, the other thing also is that if you crampona terrible Benjamin, back a crampona, he gives me that money with no interest. If even he will give me interest, it's much more flexible. I can always go back and negotiate the terms, right? It's, I mean, with terrible do also in America. I know, I mean, it's the same one, it's the same one. Terrible one to get you. So that financial support that we get, either through cash, kind, donation, all of that, and also the emotional support, as I mentioned about as I mentioned about if you're going through some difficulties or anything at all, we always there to help. Please, I know one guy that traveled to the States and they said Ghana for Casado, he didn't want to relate with Ghanaians. I'm not a Michigan side or no. It's been some years back. And unfortunately, ni maame fi mu okɔbɔ asɔre na maame na ɔmo brɛ ne flower. After that, one man they go because it was a non-garden church. So you can eat your cake and have it back. Now, the other thing also is social events. When we go to social gatherings, right, it serves as an outlet for us. So yenya tebia yeshe demo sa sometimes it gets very depressing. Please get out. And then recreational times. When we play, when we engage in activities and stuff like that, it's very rare. And I haven't seen anyone personally where they are actively enjoying a game and still depressed. We bet maybe a game no nasaba. What am I saying? But no crap it take a while because your hormones have gone, your dopamine and all that, have rushed you out for some time. Until the bed is over now, then kick right back. It's going to take some time. So the point I'm making is this: all these recreational activities, and apart from our physical health, is also good for our mental health. And also, we are what we eat. We should be very mindful. And say, you did the moon, I didn't know. It was a year. But your mama fancy, I say, and if anybody has any questions, contributions, please do ask the needful.
All right, good evening. I hope you're hearing me. Um, Dr. Phil, thank you. I'm calling from Ghana. As part of your definition of, can you hear me, sir?
Yes.
Okay. So as part of your definition of for the mental health, and I think it's by the WHO. What I find in that interests me is the social well-being. Okay, and then social well-being has the element of sense of belonging. I hope I'm right.
Mm-hmm.
Now, if my question is this, if I found myself in an extremely, and then a sense of belonging also has the element of external stimuli, means that you'd have to feel it from the outside. How people react to me or treat me is how I have that sense of belonging. If I found myself in an extremely hostile society or surrounding where my sense of belonging is flawed, would that be a mental health situation on me? I hope you get
So,
my question.
yes, if you find yourself in an extreme environment, right, can that
Yes.
affect your mental health?
Yeah,
Oh,
I think that's right. Yes.
okay, fantastic. No, you removing yourself from a stressful environment does not mean that you have mental health. It means you are taking care of your mental health.
No, could you not necessarily removing myself, but I'm talking about sense of belonging. Okay, when your sense of belonging is flawed, it means, per the definition of your mental, what do you call mental health, from that is from the World Health Organization.
Mm-hmm.
All these elements have to be intact. Social well-being, blah blah blah.
Mm-hmm.
And as part of social well-being, there that you have to have that sense of belonging. And I'm asking, if and the sense of having a sense of belonging is an external stimuli. It is not something you create. It's how you feel from the outside.
Mm-hmm.
So I'm asking, if I find myself in that hostile situation, for instance, in you guys your place, this racial
Mm-hmm.
then my sense of belonging is flawed, becomes shaky.
Mm-hmm.
Would
Mm-hmm.
that be a mental health situation on my side?
Not a situation per se, but yes, it can affect your mental health.
Okay.
You finding yourself in that environment is not a mental health situation. But yes, it
Okay.
can affect your mental. Okay, I think that we have to separate the two. Yeah, I know who it is. I mean, I'm telling you, meeting me. But I'm saying that we have to separate the two in saying that one is me finding myself in an unhealthy environment, right? That itself is not a mental health condition. But yes, it can affect your mental health. So that is one.
Yeah.
Two, if I have to excuse myself from that environment, that is not me being isolative, depressed, or anything like that. It's me taking care of my mental health by excusing myself from that environment so that the environment does not become so toxic and affect my mental health.
Yeah. I think that makes sense.
Okay. Thank you very much, Mr. Lenovo. Okay, I think the question came when I was explaining it. So I want to suggest that he probably did not fully get it. So if you don't mind giving me like a minute. Okay. So how you know somebody has bipolar itself is for a professional to diagnose. But how you identify the symptoms of bipolar, right, is the symptoms that they present. And that is what I mentioned. If they are cycling between the depressive phase and mania. So mania is a bit different from anxiety. So mania is when they have hyperactivity, hypersexuality. Sometimes they spend too much money. They engage in risky behaviors, right? Then in the next couple of days, weeks, is different for everyone, and that is why I said there are different types of bipolar. Then you find them also very depressed. They have low mood, they are not engaging, and all of that. So their mood is cycling depending on how long, and it differs for each one. And their symptoms are also very different. Right. So, as human beings, we are made up of two things: our genes and our environment. So, genetically, we are predisposed to be hypertensive if our parents do have it. The fact that we are Africans, we are at higher risk of hypertension and diabetes. When you put tuntum no yarewa no crapona, you are high risk of menikaso benyebi, but you're high risk of no crapona dose. In the same way, yes, there's a genetic component to our mental health, being exposed to mental health condition, right? Um, is there any research to cut it out a pregnancy? any day minyan hui.
Yeah, hello. Abu, I'm calling from London. Yeah, it's a bit controversial. Like in London, if your child is like ADHD from birth, they told us he's got some sort of something called ADHD, and then but he's not been diagnosed. And as he's about 12 years old now, it's having a lot of impact on him in the school. So what's the best advice if they to get the, I don't know if it's the school because of the doctors are not it's like a long process. Is there any shortcut to getting that kind of diagnosis so the teachers and the people surround him will understand him better than they do?
Thank you very much, Mr. Abdul. And I like your question, and that's why I was smiling. Um, in some communities, you mentioned, I think the last, you remember the last but one slide, I said culture and mental health. So
Yeah.
diagnosis and how mental health is managed is different from one environment to the other, right? In some cultures, diagnosis happens a bit sooner. In some cultures too, it doesn't. And this is the reason why, good reason why. Kids do go through phases. So in most cases, they may have the symptoms, but for the diagnosis to happen, they will have to wait to a certain age, right? And the reason is this. For some of us, when we were much younger, we were very hyperactive. As we get a bit older, we became very calm. For some of us, when we were younger, we were very, very, very calm, attention deficit. As we get a bit older, we became hyperactive or more outgoing, right? So you don't want to quickly diagnose and start treating something that would have taken care of itself. Hence, what we do is we always do symptom management. So if the person is attention deficit, then we have to really pay attention to the individual, try to assist the individual, and there are different coping skills that we use in managing the symptoms, whether in childhood or adult, before we get into medication. So medication is not always the first line of treatment, right? But shortcut, pardon, I don't think it's something that you even want. I know it's frustrating, and you want the help for your child as soon as you can. But let's go more with therapy, various forms of therapy to get him or her the treatment. Then later we can look into medication.
Thank you.
Mhm. Both couple, no, man, uh-huh. Is that per day do I know I excited to be at work, right? Scandal sign after they are two and so. But on a serious note, right? Circumstances do affect us. And something may happen at work that will make you feel like this work, I'm over it. Sometimes too, we are going through certain things ourselves. Then we transfer to others, right? In this case, our workplace. So some frustration we're going through, some hormonal changes we're going through, we're not feeling ourselves. We feel like it's from the work. So really, let's do the assessment. Is it really from the work? And as I say, yeah, because sometimes it's us. Sometimes too, it's the environment. Because there are dynamics also at work that will affect you. Some boss be on pay. So when he's on vacation, you're good, you love your job. Once he comes back, you feel frustrated, you want to quit. So there are different dynamics. So we have to assess and see. You can go about your activities until you crash. So once you've noticed that there is a significant, and I think the key word there is significant life changes, then you want to assess the situation on its impact on you. If it doesn't have any impact, it could be very, very significant, but that is perfectly fine. You don't have to worry. But then what it is also is there are sometimes the impact comes later. And no, the treating it then say they buy immediately. And this is why. We're trying to find out why you're so depressed at this point. But you cannot link it to anything. Because it happened like 5, 10 years ago. But at that time, we were so busy with everything else going in life that it did not really affect you like that, and you really didn't pay attention. The after now come. One of the it is said when you accident, no treaty, and after the wachi or ye bizarre. Then we're trying to see what caused it. So that also happens with mental health. So the point is this: if you can seek treatment for anything at all sooner, is better. But let's also not be quick. And really, treatment is not medication first. Therapy always comes and all of that. So you can always seek treatment if the provider assesses and realizes to say, okay, you are good at this point and you don't need to continue with treatment. It's discontinued. Later on, you can come. But if it has no impact on you, there's no point.
Hi, my name is Millicent Okanja. I'm joining you from New Jersey, USA. Thank you so much. Thank you so much for such a great program. It's been a very something like a big problem for me that just like he was saying before, somebody's having such a thing, and then all we think as Ghanaians is that, oh, way or before, or something like Alzheimer's. Yes, can you hear me? Okay, so all I'm saying is that is there any possible way that something like this can go to the Ghanaian local FM stations and stuff like that, so more people can hear of it? Because as good as the program is over here, most people are limited to come over here. That's my one question. And second question is, just like you can, like people are just about to get married and go for the test to check HIV and sickle cells and stuff like that. Is there anything or any way to check couples before they give birth so they cannot end up having children like that? These are my two questions, please.
Ooh, two heavy questions. First one is if this could get to the local radio stations and all of that. The issue is this: with subjects like this, you have to pay for the airtime. Most of us in the field, you need to scan to be paying for airtime one to the other. Because they will not. Anke leaky business idea, anko more free airtime no become was. So that is that. Because there are so many professionals in Ghana who are willing to educate, in and outside of Ghana, who are willing to educate, but we can't afford the airtime. So that is that. The question of say oko warrior young test so that you don't bring kids into the world with mental. Me who have men cannot where it doesn't sound you, but me patrol you see and tested for hypertension to make sure that we don't give birth to kids with hypertension or put them at that risk. So if we do that, then we're making it seem like mental health is something that once you have, you cannot live, or it makes you dangerous to society. And I say it fuels the bad connotation we already have. So I don't think say, and not too. mental health in Ankasa, it's just like hypertension. When you were getting married in your 20s, you did not have hypertension. You got it when you were in your 40s and 50s when life really was lifing, right? And you could test me in my 20s and 30s and I'll be zero. And I remember the only mental health condition I may have is anxiety because I'm prepared for the wedding and I'm anxious about it, right? Like the Brazilian. But ɛkyɛ no na afei de mmɔfra ne ba na ɛyi na adwumasɛm na all of that ba na Mr. T enya no. Anesthetic conditions also comes different stages in life. So if you even do the test, you may not get it. But I also don't think it's we should be testing people to disqualifying them from having children. Always have grace. Because if you understand that my behavior was caused by my mental health, right? You're going to have grace for me. I guess that's the implication of the question. But holding me accountable for my behavior, no, then you think, so, okay, it wasn't caused by it, therefore, now what? So the simplest answer is always have grace. But here's the thing. Why should I determine whether it was mental health or not? So this is my answer. Always understand people. It doesn't have to be because of their mental health. We understanding people is good for our mental health and our ability to have better relationships with others. So if I understand, they say Philip is always joking with issues. Next time I can't say often it too serious. You do so at your own risk because you know that is who I am. If you know, say, when Philip is angry and he raises his voice, next time we are there, me bufu me command me neso no catch him say Matthew until we gamia. That is like know people. What am I saying? If you know that this person is arrogant and you still want to work with them, know they are arrogant and you deal with their arrogance. It doesn't matter whether they are bipolar or anxious or depressed. So when they do something and it's arrogant and you want to tell them. Like some people mental health, they can still decipher between wrong and good, unless they are schizophrenic and in a different world. But anything else, they have the sense of reasoning. So you have to draw the line somewhere. When we have the opportunity to talk about personality disorders, we can discuss more about how people act and how we can manage them.
Yes, sir. Hello. Yes, my name is Gideon Daze. I am coming from Phoenix, Arizona, USA. Phoenix, Arizona. Accident.
Kasa.
Okay. Well, I want to say thank you guys so much for this wonderful program. I don't have any question. I just wanted to say thank you, and everything you say is true. The reason why I know, because I have a daughter who have a schizophrenia and bipolar disorder. The signs started when my daughter was quiet when she was a child. She don't talk too much, she's quiet, she's timid, and she experienced a lot of bullying at school. 7th grade, she started showing symptoms. But I took her to the doctor. The doctor wanted to start the medication. As a parent, no parents want to admit that their child have a mental illness. That's one thing. And you mentioned that in your program, and I appreciate that. No parents. But I just want to say, please, it's not a shame to admit that your child have a problem and accept treatment if you come to that point. The second thing that I want to mention that was, the lady mentioned about Ghana. A lot of people think that when you have mental illness, you have some kind of demons or something. It's not only Ghana that people believe that. Here in America, people believe that. I go to the church where many of my church members believe the same thing. But the one thing that I want to mention is if you're a parent and if your child have a mental illness, Be there for your daughter or your son. Do everything you can to support them, because a lot of people don't know how people will look at your daughter or your son and think that, oh, they're being bad, they're being disobedient. Only the parents can understand and be there for their child. So if your child is going through these symptoms, please don't be shy away. Find treatment for them and do whatever you can to support them. And that's all I want to say, because
Hi everyone. So I want to ask the doctor. Thank you, doctor, for the good work, and thanks, P.K. By the way, I saw you yesterday and I couldn't say hello. By the time I realized to say hello, you were gone already for the fufu party.
Hey, ebi could be for mental health.
For the GMA, for the GMA fufu party, I saw you. Yeah, mameka. Now me see Dr. Mpacho. And then you be mental health, you be free because some pa. That's it.
Pacho, what could you do for no mental health in one?
I
No, I answered. Who you walk way?
the doctor knows that. Yeah, he's gonna answer me.
Okay, so the question is, better if you mental health you, and my answer is, who you akwahin? Like, how can we manage it? Will be a better question. But how do we live? Like, it's part of us, right? Just like how our hypertension and diabetes is part of us, it is also part of us. But what it is we always have to know what our stresses are and manage our stresses well, so that we don't get to the extreme end. And it's not only caused by stresses. As we mentioned, genetics is also part of it. If you are predisposed, you also have to know yourself and manage certain things so that you don't get exposed to it. But mental health is not going to leave the world. Self-fulfilling prophecy. That is what I thought about in adding the DSM-5. So I want to think it's people are, because it's like DSM-5 is available to almost everyone, right? You can Google and get it. So people are self-diagnosing, right? That is what I'm thinking. And if that is what it is, yeah, I don't know, we are not started diagnosing. And that is why I mentioned that let's not do diagnosis and focus on symptoms. Understanding what the symptoms are is more important, and managing it well than diagnosing. Because first of all, please do not go around diagnosing people when you don't have the license to do that. All right. Because you'll be misdiagnosing. And if you also do that, it doesn't help for people to seek treatment. If you go to someone and be like, I want the over bipolar and the chronic doctor, 99% of the time, I'll move you. My grandpa no can say me. So if you go with the symptoms and be nice about it, right? Now say me who say I say why mood no idea or be yakobo crowd ma Chelsea as an argument you don't engage like you've lost interest in things that you once enjoyed. Now lady wedding one baby, right? So it becomes more symptom based. You are more isolative. Sorry, I'm cautious. Oh no, you get what I'm saying. Like you invite to you know you grow. What do I say? I know say you got an invitation. Oh, VIP table. I watch them all okay. Yeah, Mary answer no yeah. Okay. Mr. Millicent, he has a Millicent, we can talk.
Hello.
But I just
Hello.
want to say there's something called transference, right? Sometimes we take on the mood of what is going on in our environment, and it's very important that you manage it well. And yes, and now you're always going to be heavy. When I say heavy, I mean like you always carry the burdens of others. It is also true that what people do around us do affect us. It does happen, but your ability to manage it well reduces the impact it has on you, or whether it will even have an impact on you.
Oh, hello. My name is Dr. Madi. I'm speaking from London. Somebody asked a question about pregnancy and mental health, and I wanted to say something about that. I just wanted to say that, yes, there is mental health issue within pregnancy. During pregnancy, we have extra hormonal activities such as estrogen and progesterone doing overtime. And the pregnant lady can become depressed, can have low mood, or can be anxious, depending on their circumstance. Some mothers have husbands who work away from home, and therefore they are left on their own for a very long time, so many days at a time. Others face financial difficulties during pregnancy. So depending on the circumstance at the time of the pregnancy, there are mothers whose pregnancies are not acknowledged by the man who impregnated them, and all those things affect their mental health. So yes, we do have issues with pregnancy, antenatal, perinatal, prenatal, and about 10 to 20% of pregnant women, suffer from mental health issues in pregnancy.
Doc, thank you very much for that information, and it's very true. But the question was not whether there's mental health related to pregnancy. The question was if we could cut out mental health from the gene during pregnancy. And that is what I said. I don't think there's anything there to support that.
Sorry about that.
Mm-hmm.
All right, good evening, everyone.
Sorry.
Yes, a quick one. I'm calling from Ohio. This is a big man. Doc, I want to find out, most of us. Oh, keep it, patch on me. Doc, any chingam. All right. So we are coming from the millennial background, and Yanumbi, once a discussion broke up, said sometimes the sort of treatment and then a year your parents are maintain out to in a way we feel our parents need to explain to us certain things they did, because if you want to see a bro in a way they were trying to some more correcting, but basically any who I yentias obi kura the papa ba social media trying to say the dad needs to apologize why certain things the dad needs to a lady, yes, a lady, yes, and it's funny, but it's serious. I mean, I also brought that topic somewhere, and everybody was coming out to say our parents owe us some explanations to certain issues and out to yen. Can that also constitute mental health? And at least they were trying to correct us by and there were certain things that they might have told us whilst we were young. To them, they were just trying to put us on the right track, but it has affected us in a way till today. Say, Ama, and then no, you don't even know whether your parents were right or wrong, and then you don't know who you are going to explain, and that thing is still sitting with us till now. And yeah, I don't know if doctor can elaborate on that, or that can also constitute. Right.
If I repeat all of you, repeat the last part. When do BTs is our it's like if you're okay. You in the meantime, we bet me use Uber, not the Tesla, not Brenham will use 1 month. But to answer in Desmond question, no, I think it's a serious conversation to have, right? I'll say, are you answering his question? If so, I'll give it. Okay.
Yeah, not I was trying to explain, say, let's not this discipline any abuse. And when it comes to young Africans, you bet see I will cheer for the way I be abuse in you know. We are confusing the two. That's what I wanted to say.
All right. And that was part of the point I was going to make. But King David made a good point, though. But the part that is very funny to me is that our parents owes us an explanation. Then I also want to ask the question, do we also owe our parents an explanation for the frustration we took them through? I think it's only fair to ask so that we can be fair to both. This weekend, I was at a retreat with our youth from church, and we did one topic, understanding our parents. And this, of course, came up. You cannot do such a topic without that coming up. Understandably, and I mentioned this also culture and mental health. So in certain cultures, what was seen as discipline, pure discipline, no malice attached, in certain cultures is seen as an abuse. And that has its complications, right? So what they did as a form of discipline right now, due to our current exposure. So note, we are using our current situation and exposure and everything to measure them for their exposure they had in the past and resources available to them in the past. So I want to say, King David, I really understand your question and I really get where you're coming from. But I seriously also think that will be unfair to them if we continue to demand an apology or explanation for them now for actions they took in an environment which resources they used. I don't know, say, I said they go away preaching. I don't know, say, for what no, but I don't know, say, it's here for if you get where I'm coming from. So the point I'm saying is this: for every good intent and purposes, all parents, and I started by saying good intent and purposes, and I said most parents, just to be safe, whatever they do for their wards, their children, is with good intention. And during the discussion this weekend, one of the youth mentioned, the youth leaders mentioned, said, your independence in the future is your parents' comfort. So the goal for all that they do is to make sure that you are independent and you are not a burden to society or them in the future. So, me ka baby say, no, we've learned different ways and knows certain words impact us differently. And therefore, we want to go back and apply that in that environment. Now, I think, but now too that we know that the millennials and the Gen Zs and the Gen Alphas and Omo, they don't have the thick skin as those in that space. Yes, therefore they don't have the thick skin as those in that space now, those times now. Then it's also fair to educate the parents now on some of the effects and repercussions of certain words and actions that they use and its impact on the current generation. Then we're talking about the same era. But I said to go back, and I think that we're also unfair to them, right? In so many ways. And their action and reaction, they do almost go through and the mom they almost for the most part. Um, All right, so I think the summary of all this is mental health 101, and it's 101 because we just deal with the basics of mental health. And the take home is this: mental health is not a death sentence. And just as people have hypertension, diabetes, and the rest, people also do have anxiety, depression, bipolar, and the rest. So please, if someone is to have any symptoms related to mental health, in your attempt to help them seek help, please do not go to them with your Google version of what the conditions are. The ohuno and oka and yet diagnosis are audience a it comes with resentment and people do not seek help. It is also true, say, environment do affect us. Our genetic disposition also puts us at a certain risk for certain conditions. But all of that, we have to know our basis. So your baseline now, we're able to manage it well. I know that I have a risk for hypertension, therefore I have to watch what I eat. If I know that I have a high risk for anxiety, then I also have to be mindful of the things I expose myself to and find coping skills. As I mentioned, if your risk of hypertension and therefore you're exercising and watching your diet, if you know that you have anxiety and then you got to do public speaking, certain things that you do to help manage your anxiety, please engage in, but do not engage in maladaptive behavior. And fat drugs is a bit me a casa unipe, and I'm a that is not treatment, and that is not a good way of managing your anxiety. So on this note, I want to thank. Oh yeah, before Zenex. No, I just want to say thank you very much for the opportunity to come and present. It's something that I do with joy and passion. If you are of any group, whether religious, society, fan club, whatever it is, maybe about na menu ahyia bia no, Yesu wɔ hɔ nom a na mɛtumi aba hɔ. That and also one theater I want to say. Ah, oh baby, oh many present.
Yeah, Dr. Phil, Dr. P.KAY, and I'm gonna say, and to all those who contributed, so we say thank you very, very much. And I will really appreciate it. Mental Health 101. We hope and believe, say, as the saying goes, in our local style, we'll be about them, but depending on your level, So we pray that God will continue to manage us through these things, Yes, we're more than and try new steps, So at least, ever going. Thank you very, very much, Doc. And we really appreciate your time, your energy, and everything. Thank you.
Already, just Oyebana Ngasa. No, Chameka Academy to be Tia Clutch in India Slate and so on and so the Chalate woman.
Thank you.